Hello, my name is Christoph Schnelle. I'm a PhD student at Bond University in Australia. The authors of this paper have been wondering the following question. Do medical doctors actually make a difference? A doctor is present in the large majority of medical interactions where we have a doctor, a patient and an intervention. Would it be therefore useful to know if and when a doctor makes a difference to patients' physical health? The doctor can do obviously well if they choose the right intervention and the right diagnosis and they administer the intervention correctly. But is there more to this? Are there differences between doctors even when they use the same intervention, and even if we account for all known factors like qualifications or experience or the patient risk factors or the quality of the place where they work, for example if it is a hospital? If doctors make a difference beyond all those known factors, then even a small difference between doctors will have a big effect on patients' physical health, because a doctor prescribes him or herself for almost all medical interventions. Therefore, that effect will be present pretty much all of the time. That was our starting point, and we found that in mental health it is even taught in textbooks that the practitioner matters enormously, that a good practitioner can do much better with their patients than a bad practitioner. It made sense for them to look because a few decades ago in mental health they found that most drugs used work little better than placebos, except for the very worst cases. After finding that, they then had to look elsewhere, and the obvious place was to look at the therapist. In medicine it's different. Most interventions have a positive effect or work, and there's a huge body of research that shows that these interventions have an effect and where they do. Therefore, there is actually very little research on doctors themselves. And where there is research, for example, whether doctors with burnout do better, worse, or the same as doctors who don't have burnout, such research is hotly contested. As a result of this, we looked through over 10,000 research papers to find just 30 papers that answered the question, does a doctor of any specialty except surgery affect patients' physical health after accounting for all known information? The fact that there are only 30 such papers among more than 1 million published research papers is in itself important information. The next important item is that there are no standards for reporting such a performance. So there is no possibility to make a meta-analysis, but there is a lot of descriptive data showing under what circumstances doctors make little difference and when doctors make a substantial difference. We recommend that you read the paper to have these questions answered. If doctors make a difference, and this difference can be quantified, and this has been done, then this quantified difference allows the improvement of doctors whose performance is below average, the confirmation of doctors who do good work, and especially the identification of positive outliers, exceptional doctors, and the possibility to learn from them in one way or another. As you can see, doctors matter, and their performance matters as well. Thank you.